Hi, I'm Dr. Laura LaPiana. I'm a clinical psychologist, and I first started working in the field of addiction about 20 years ago. I've been at several facilities inside and outside of Malibu, and I find that MBRC is really special, and I say that genuinely. They have certain features, besides the great staff and overall program, that I think really sets it apart from any other facility I've ever worked at or encountered. And a couple of those components, which I was asked to just speak briefly on, are the diet. So MBRC has our great low glycemic diet. And what I find is people come into treatment and they start to heal their bodies. They start to gain a sense of self-efficacy around self-care. And they start to feel kind of better more quickly than facilities that are offering, less of a whole food diet, sugar and all those things. The number one transfer addiction is sugar, and that complicates issues of the brain healing, depression, mood, all those things. So MBRC offers that, and I think it's fantastic, and I see people get really well, and I also don't see people gaining 30 pounds in 30 days in treatment and then yelling at the staff about that happening. We also are able to pull off something that I think is fantastic that other facilities say they can't do. And we have this 2-week blackout where people come in and they don't use the phone and they don't use the computer, and they really just, what I call, let the swelling go down. And they start to focus on themselves, they start to get quiet, and they do that work. And at the facility, we make sure that they have that parameter and that boundary to let that happen. And I've seen a lot of good work come from, that starting point. So I'm a big fan of MBRC. I'm excited for the women's facility. I think it offers an extra little element in there, definitely, especially for some women. And that's it. Thank you.
What is your vision for the future? What do you see happening with addiction treatment and with drug use, with harm reduction?
What do I see, or what do I want to see?
You can give me both.
Okay. So I would like to see this gradualist vision, which again I crystallize it, but it started even back in Liverpool, where people talking about making gradual change in the early days of harm reduction. So it's always been there. I would like people to use that kind of language to begin to see themselves that way. What I think does not work is you have people in a harm reduction setting with harm reduction values, this whole incredible culture of nurturing and connection and affirmation, and then the harm reduction group, they send them to mainstream treatment, which is getting better certainly, but still punitive, patriarchal, harsh, and it's not very good to transfer patients anyway, but that's not a good cultural shift. So I think what we need is, in the harm reduction movement itself, to begin to have spaces of people who want to seriously moderate or seriously stop using. I know on, what's the website? Moderation Management. My understanding is there's actually a chat room now for people who want to stop drinking. And this evolved out of the needs of the people in that group. Instead of going, hey, we'll just stay in we'll stay in moderation management, we'll just have our group where we stop drinking. They don't want to leave, which I think was a beautiful model for us. So I think harm reduction needs to develop their own places, their own rooms, spaces where people can say, I've gone through this stuff and now I want to stop, or want to try stopping, or seriously moderate, or seriously, have a different relationship with the substance. So I think that would be a very, very good idea. I'd like to see harm reduction psychotherapy spread throughout the world, in its various versions. I think we need much more complicated ideas, much more complex ideas about how people are with addiction and how they get better. Our treatment system is failing, and that's one of the reasons why I wrote that paper, is that nobody wants to say it. We're wasting millions, if not billions of dollars on failed treatments. We're not serving our patients. In fact, we're not even seeing this paper, seeing them off as prisoners or something else. And we need to see change with that, and I think it's an exciting time because there's so much going on with medicine, there's so much going on with clinical psychology, the grassroots, recovery itself, interesting things going on there, your own work, work of all these other groups. it's a very exciting time with this whole thing, as well as dreadful time because addiction is spreading throughout the planet. So we're in this difficult, wonderful, strange time. But I'd like to see more mental health, more psychological models, many of the things I've been talking about so far, all these things in play. And maybe less warring between the camps. Maybe we kind of get along better and respect each other. And there's room for traditional 12-step, and there's probably, I'm not a huge fan of it, probably room for traditional TC for some people who find that that authoritarian superego thing to be helpful to them, as well as real psychotherapy. We also need to train more people because I think the addiction people have kind of kept the mental health people at bay. So we need training that, and my ideal is that everybody who works in addiction will have both a addiction credential and a psychotherapy mental health credential. So I don't know if that gives you, obviously war of drugs needs to stop, and that kind of stuff. That's a little beyond the issue of treatment.
That's just such a wonderful, thing about Castlecraig, as well as it gives people opportunities to, particularly once they're in the extended care unit and looking at leaving treatment, that they consider these kind of things for themselves, about education, about bettering themselves, about sort of doing something they've maybe always wanted to do but never could because of the alcohol and drugs. And for some people that may be college or university or training, and I think that's great, and then eventually getting involved in work, because again, so often addiction creates unemployment, an inability to be responsible. So part of recovery, of course, is that there is a sense of giving back to the community, giving back to yourself, giving back to your family. And I think that's such a wonderful ongoing thing, really. Which is totally the opposite of addiction, because addiction is about isolation, about loneliness, about a sense of ignorance and arrogance, that really, is not helpful in life, I suppose. So.
I feel so passionately about what we do here at Castlecraig Hospital. Okay, we transform lives here. An example of a life transformed is someone who comes in here, whose life is totally and utterly controlled by their drug of choice. Not only their lives, the lives of people around them. They wake up and they think about their next fix or next hit or where am I going to get my next bit of drug? How am I going to get it? Where am I going to get the money to get it? Where am I going to use it? How am I going to use it? How am I going to hide what I'm doing? Who am I going to lie to get, how am I going to get this and use it? And once I've used it, I've got to recover from it and then start the whole thing again.
Sounds quite complicated.
It is complicated. It's exhausting. Our patients come in here absolutely exhausted from this process, and their families are exhausted because they've just hit the end. And so this individual's life is, in other words, controlled by a bottle or a bag or a thing. And there is no life because they're not living empowered, effective lives. There's no self-efficacy. They're not fulfilling their potential. I think if you ask any of our patients, they'll say it's been a long time since they felt good from using the drug because it becomes necessary. They need to get the drug in order to function. And without it, they can't. There's withdrawal and there's very unpleasant side effects of withdrawal. So they can't, they're not living fulfilled, empowered lives. It becomes all about the substance and the associated behaviors and associated conditions and effects of it. And the family are all about, where is he? What is he doing? Is he okay? Is he in trouble? Do I need to go to a hospital to fetch him? Do I need to go to the police? Which hospital is he in? Is he in a fight? Is he lying in in the street somewhere? Are they hungry? Do they need feeding? So the family become all about that, their worry and fear of that individual. So you lose their own vitality. They're not living empowered, effective lives, joyful, fulfilled lives. So what I see is after a while when I see a patient, it's almost like once the effects have worn off and they start to come to, if you like, it's as if the authentic person in there starts to emerge through their features, their face, and you almost want to say, there you are. It's amazing. So it's a transformation on a spiritual, on a physical, on an emotional, psychological level. Transformation from a wilting life to a thriving life. And it's an absolute privilege to witness that, and that is something worth waking up for in the morning. It's lovely. I love what I do.